Hello, everybody. Today I'm here with the Health and Safety Board. My name is Jessica Kelly, and I'm the Workplace Injury Prevention Supervisor. Today we're going to be talking about health and safety in the workplace, and I'm specifically addressing the 2000 nursing staff here at North Pond Hospital. Today we'll be talking about the greatest workplace risks that nurses are faced with on a daily basis in the hospital, and I'll be primarily focusing on body mechanics and back injury prevention. As nurses, you are facing factors on a daily basis that put yourselves at risk mentally, physically, and emotionally. The reason I am here to speak with you today is because being informed and prepared is the best way to prevent injury from occurring. I have a quote here from the Registered Nursing Association of Ontario stating that a healthy work environment is a practice setting that maximizes the health and well-being of nurses, quality of patient-client outcomes, organizational performance, and societal outcomes. The reason it is so important to address these risks is because as nurses you are statistically at risk for the highest rate of non-fatal workplace injuries. So on this slide I have outlined the work environment hazards that a nurse may be faced with on a day-to-day basis. First we have manual lifting, which would be due to um, patient handling and movement and is the leading cause for back injuries within the nursing profession. Next we have assault, which could be a result of physical or even verbal abuse from a patient or family member and affects as high as 1 in 4 nurses. Next is workplace bullying, which is harassment between colleagues within the workforce. We have trips and falls, and I've also listed emotional trauma just due to the high intensity and volatile situations that nurses handle on a day-to-day basis. Over here we have a graph that outlines different healthcare personnel. In the two lighter blue colors here we have what represents nurses, and as we can see in the patient handling and movement category as well as the workplace violence category, nurses are the most affected and most at risk for these incidents. So nurses have one of the highest incidences of work-related back injuries of all occupations. In this graph here, we see that registered nurses, nursing aides, and attendants are prevalently affected out of the listed occupations. It says here, according to this graph, that over 62,000 nurses are affected with back injuries related to workplace risks. And annually, it affects approximately 40,000 nurses in this profession. Okay, so now we're going to go into more specifics about back injuries within the workplace, how they're acquired, and how we can address this. So moving and handling patients is the most prevalent way that nurses are affected with back injuries, whether it be pushing, pulling, lifting, or carrying a patient. So we have some points here listed on how we can briefly change our um, ways we push or pull, lift or carry, and we'll also go more into detail about body mechanics and what we should always keep in mind to keep our back and body safe. To reduce bodily harm when lifting or doing strenuous activity outside of the normal movements, it is essential that nurses are using proper body mechanics. So proper body mechanics is the efficient use of the body to produce a motion that is safe energy conserving, and physiologically efficient. Balance and control is used to avoid injury both to the nurse and to the patient. So it's essential to be practicing per body mechanics in order to avoid musculoskeletal strain, injuries to members of the staff, so the nurses, injury to the client, and fatigue. Okay, so moving on to the most important part, prevention techniques. Essentially, we want to be lowering the risk of workplace injuries, specifically back injuries. So I've listed 3 main techniques to avoid injury. So the first being stable center of gravity. It is important to remember to keep your center of gravity low. Greater balance is met with a lower center of gravity. So as we can see in the upper right corner, it's important to flex your knees and keep your body straight rather than bending. Next, it is important to maintain a wide base of support. So as demonstrated in the left-hand lower corner, um, having a wide base of support gives your body more stability. Spread your feet apart to a reasonable distance. Flex your knees to move the center of gravity close to the base of support. And that's where you can find the most stable strength when lifting. And for the third technique, it's important to maintain proper body alignment. So body alignment refers to the way that joints, tendons, ligaments, and muscles are arranged when initiating a position. In the right lower corner, we can see how the nurse's or doctor's spine is aligned. So keeping proper body alignment is what will prevent the wrong movement. A line of gravity passing through the base of support maintains your balance. So equal activity balance in upper and lower parts of the body would reduce your risk of having a back injury. When your stronger muscle groups are involved, a greater amount of work can be safely done. It's important to keep the back upright when performing interventions. All right, so finally I've got some nursing considerations just to keep in mind on a daily basis to keep your rate of risk down. All right, so um, for moving patients, it's really important to know the weight of your patient and consider the mode of transportation. And by that I mean whether you're going to be moving them to a gurney, using a stretcher, or a wheelchair to help you ambulate and transport. Next, know your own limitations and be realistic. If you can't safely move a patient on your own, there's nothing wrong with asking for help. Have a plan of action. So whether you're working alone or with a partner, know how you're going to plan on moving the patient, what steps you'll be taking, and if plan A doesn't work, what next action you are going to take. Next, always communicate, both with your colleague and with the patient. When everyone is on the same page, injuries are minimized and all efforts are more efficient. And most importantly, again, just know your limits. If something's beyond your ability, there's nothing wrong with knowing when to stop. Well, thank you so much for listening. That concludes the PowerPoint from today. I hope everybody learned a little bit and is putting these skills now to use so that we can together reduce risk within the workplace.